Good evening, everyone. So, like my colleagues, I am also going to start this presentation with a question. How many of you feel sleepy? Everyone? Okay. Let's do a kind of exercise because this is an important talk. So, everyone please laugh out louder. சிரிக்கிறது கூட கஷ்டமா? Laugh out. Come on. Look up. Look up. Look up and laugh, please. So, நான் சிரிச்சா வேற மாதிரி இருக்கும். Okay. Okay, to start with. So you have good knowledge about choosing a racket. And you got a good knowledge about choosing your shoes. And do anyone have knowledge about choosing your injury? Of course, you don't. So always expect the unexpected. Injury at the court might be of any chance. So look at this video to know the injury chances. So got a chance for laugh? Exact on-court injury, right? At the middle of the court. Only thing is the net is not available over there. Okay. So to classify the injuries, I put forth two types. So acute injuries and overuse injuries. Acute injuries, injuries following a fall or hit by a racket or someone pushing you down like the video is called acute injuries. Whereas when it comes to overuse injuries, injuries without a fall. Like a player when getting into the court, he might not have any injury, he might not have any pain at all, but once he starts playing, when the game progresses, he suddenly stops saying of pain. So that comes under the category of overuse injuries. So how we are going to treat those injuries? So now first let me just clear about the acute injuries. So we have to categorize first. What is categorization? I just wrote as can play and cannot play. What is categorization? So you got to question me. So I am just going to answer you without your question. So காலையில் மோகன் சார் கேட்டிருந்தார் நினைக்கிறேன், like regarding your son. So when someone says, with the game progressions, I have severe pain, and you are about to assess him, not the sport specific evaluation what Anup was dealt with. So this is about whether the patient can continue the game or should he be taken out of the court. So when you think the player can continue the game, he comes under can play category with the green tick. And when you think the player who complains of pain should not continue the game, he have to be under cannot play category. So the two main categories what we indulge in. So one is the can play category and next is cannot play category. So how to categorize? How we are going to categorize? So simply when I say categorize, you need to pinpoint it. How we are going to categorize? So we have three main tools to categorize who can play and who cannot play. So the three main categories are pain, swelling and your weight bearing status. So these are the three main tools what we medical professionals use to categorize. So I am just going to teach you, the coaches and the co-players, to assess. So how to assess your pain? So can anyone measure the pain? Do you have a tool for measuring the pain? Of course, yes. So this is a simple scale to measure your pain. So when 0 denotes no pain. 10 means it's the highest level of excruciating pain. You can ask a player, 10க்கு எவ்வளவு வலி? So he have to say in numbers like 0, 1, 2, 3, 4. So if the player says the pain less than 3, he can be treated and he can be made to play in the court in that particular game. But if the pain is so severe, not even so severe, even at the moderate level, more than 3, please recheck once again whether the player can continue the game or not. So next is the swelling part. So swelling part, this is an easy way to categorize. So if you have a very mild swelling like in this picture, you can still ask the player to go for the to continue the game. So whereas when it comes to a severe swelling category with the bruises and all, please restrain the player from the game. And weight bearing. So what is weight bearing? ரெண்டு கால்ல ஒண்ணா வெயிட் கொடுத்து நிக்க முடிஞ்சா ஓகே குட். ஸோ நல்லா நடக்க முடியுதா வித்தவுட் எனி டிஸ்கம்ஃபர்ட் இஃப் ஹி கேன் வாக் அண்ட் இஃப் ஹி கேன் ரன் வித்தவுட் அ லிம்ப். சில பேர் தே கேன் வாக் வெரி ஈஸிலி, பட் வென் வி ஆஸ்க் த பிளேயர் டு ரன் ஹி மைட் ஹாவ் அ ஸ்மால் லிம்ப். ஸோ தேட் ஷுட் நாட் பி தேர் இன் த கேம். ஸோ இஃப் ஹி கேன் ரன் வித்தவுட் த லிம்ப் அண்ட் ஹி கேன் வாக் வித்தவுட் எனி டிஸ்கம்ஃபர்ட், he can put into can play category. Whereas if there is a mild limping in the running and he could not even walk without the limp, do not able to load the leg, which means he cannot even trying to stand in one leg, please put him in cannot play category. So you have categories. You have categories. So you are going to treat and you are going to put him back into the game, or you are going to put him back out, you are taking him out of the court. So how we are going to treat the can play category? Use vapor coolant sprays or pain relief sprays. So of course many of you have used it already, and you can use ice supports, icings and supports. Yes. So when I say support, will it be a good support for a badminton player? Pads, gloves, helmet is, yes, Ashwini has the helmet also. So will it be a good support? என்னப்பா எல்லாம் தூங்கிட்டே இருக்கீங்க? Come on, louder please. Yes. So you can use a support like kneecaps, and even small tapes will help you in progressing the game, and you can finish the game by then. So when it comes to cannot play category, how you are going to treat them? Yes, you can give some support for the ankle or the part which is injured, and you can use the crab bandage, you can use the walking aids or even a wheelchair to take him off the court. And off the court to where? Off the court to where? To, of course, not ortho 1, but if it is in Coimbatore, please ortho 1. Nearest sports medicine center. So next comes to overuse injuries. When it comes to overuse injuries, I already told you, injury without a sudden fall. So this player will not have any sort of pain while entering the court, any discomfort. He will not be complaining of anything. But once he gets into the game and when the game progresses, he suddenly slowly says some discomfort. And if he just continues playing with that particular discomfort without getting treated, he will surely end up with some severe pain. So we are going to treat them. And the common most discussed overuse injuries are shoulder pain. As in the morning, sir has to, Vimal Kumar sir have been telling repeatedly 1500 smashes on a day. Shoulder of course gets injured. And tennis elbow, anterior knee pain and the ankle injuries are the most common overuse injuries what we see in badminton players. So how we are going to treat? The same, categorize first, can play category and cannot play category. In can play category, you are going to do icing, pain relief sprays, play with support. And this, when I say play with support, this is only for that particular game, not for the next game and the next game also. You have to take that support off as soon as possible with the proper rehab and exercises. And when it comes to cannot play category, take him off or off the court and with proper rehabilitation. So a British Journal of Ophthalmology in 1987 published a paper stating about the eye injuries. Once we were taking assessment in Maya Badminton Academy, one of the player who has come today, I think, he was just mentioning about his eye injury. So yes, eye injuries comprises of 6% of the badminton injuries in total, and 14% of the eye injuries were hit by the racket, who is your partner, and 86% were hit by the cock. 70% were prevalent in doubles, whereas 30% in singles. Yes, eye injury is severe in badminton too. And most these eye injuries are not penetrating injuries. Which most are like it just takes the transparent layer. Eye la irukka oru transparent layer la mattum oru chinna oru we call that as ocular injury, or chinna scratch mari airum, but which will and this will automatically let you psychologically depressed, because when you go forward you will tend to resist yourself to go forward for the game, which automatically decreases your performance. So how can you protect your eye injury? Is this good? Yes. You have to use a simple methods like using an goggle. Of course, I have seen players playing goggles in YouTube and other games, but I have never seen an Indian player playing with these goggles. I don't know why, because they might have some good eye vision. Okay, now it's my question to question you. A 22-year-old male twists his ankle while taking a jump smash. What will be your code of treatment? Can anyone get up and answer? Come on, yes, please, sir. That's great of you, sir. You didn't listen my talk, I think. You need to categorize first. No, that's what I'm saying. After listening to my talk, what you have gained, you need to categorize first. That's what I wanted you to know. That's it.
It's a spray.
Yeah, you can first categorize first. You have to go into can play category or cannot play category, and then you can do the interpretation. Thank you. And next scenario, a female player, when playing a drop shot, twists her ankle and falls down hearing a pop sound. Can anyone answer for this? Yes, please. Mike.
We have to see her CVRT. If it is she unable to walk, like as I said, we'll keep in the can't play, because popping sound leads to any soft tissue injury or ligament injury. So definitely it is a grade 3 injury, probably. So we'll keep her in the can't play category.
Okay, how are you going to treat her? Categorized, and what the treatment is?
It depends upon the grade of injury. If it is a 1, immediately no problem. But if it is 2 and 3,
with the code you cannot assess the grades and all. In the code you cannot assess the grades.
yes.
So how are you going to treat her?
Yes, first the price technique, rest ice compression.
Take him off the court,
Yeah.
take her to the hospital. That's the best way to treat. Okay? Thank you. And next scenario. A player taking an overhead smash, sudden shocking pain feels like his or her shoulder coming out. So, what the treatment will be? Can you try something heroic? The great manipulation. That's it. And at last, patak. Yes? Sorry. So, never try this at court. This is what I wanted to mention. So, what can we do for the shoulder? Shoulder is not a weight-bearing joint. We cannot assess the patient to do push-up and sort of things when she complains of any pain. So, all you could do is check whether it is dominant side or the non-dominant side. If he is a right-handed, if the injured shoulder is his right shoulder, please restrain him from the game with a sling. And if it is a non-dominant shoulder, you can still categorize and progress as the treatment. So you should always have a sports injury kit bag with you when you organize a tournament or when you go for a court. So this bag should contain ice bags, cold sprays, pain relief sprays, and pain relief ointments, and slings, splints, so which can help you to immobilize that particular joint very easily, and walking aids. So if you are unable to lift that particular patient, if he is so heavy, you can ask him to use this kind of walker or crutches to move away from the court. So to summarize, categorize first before treating. Do not push the player when he is in pain, and do not hesitate to take him off the court in case of injury. Always have pain relief sprays in your kit. Seemingly a simple injury might end your sports career. Thank you.